On 102.7 Mom FM 724. Good morning, West Michigan. Chris here with you. Welcome to it. It's the morning show on Mom FM. Starting to see daybreak out there. Looking good. And speaking of looking, we have to make sure that we keep our eyes healthy no matter what, because it's part of getting through life as much as possible. And in the studio with us, we have Dr. Large from Riemer Eye Center. He is visiting with us. John Large. John, we invited you to the studio. We wanted to talk about something that many Americans deal with, and that's diabetes. And as well, dealing with eye disease and having diabetes, but also how we can do some preventative measures from not seeing you as much, right? That's an opportunity. Well, welcome to the studio this morning.
Thanks for having me.
Yeah, absolutely. Let's talk about this topic. You see diabetics quite a bit, I would assume. You have people that enter your office, and they want to as well keep their eyes healthy. What are some of those conversations like when you're sitting down with individuals with diabetes? It's a serious conversation, isn't it?
Oftentimes it's very serious. A lot of times you're seeing a patient for the first time, and you ask them, when was your last eye exam? And very common response is, well, this is the first one. Oh, yeah. And you're talking about 30, 40, 50-year-old person. And so then your next question is, well, when's the last time you saw your regular doctor, your primary care provider? Mm-hmm. So when they come in, they're having vision problems. They just think they need a pair of glasses or contacts or whatever to make their vision clear again. They don't know that what's causing this blur is actually a systemic disease that can create a very bad vision situation or even blindness. Mm-hmm. So it's a lot of education and kind of telling the patient or the person, this is what you got going on, this is what you need to do, and we're going to take care of you from here.
Absolutely. And hopefully that reassurance, or at least those initial steps of guidance that people would adhere to and say, okay, my health is in your hands, because, and I don't know how long it takes. Actually, I'll ask that question of you, and every person is different. I understand that. But when somebody is diagnosed with a diabetic-related issue to their eyes, you had mentioned that it's possible to go blind, right? And how long could that take between maybe the diagnosis and that happening?
Oh, it's a little bit different for everyone. And let's say a new patient's coming in and they don't know they're diabetic. They're there for blurry vision. I dilate their eyes, make their pupils big so I can see their retina, which is where we would see the effects of diabetes. Mm-hmm. And, if they have bleeds, we call MAs or microaneurysms, or dot blot hemorrhages, or exudates, or cotton wool spots, or swelling in the retina, I mean, they have been diabetic for a while. Okay. And they may not know that, but let's say they have this going on, you're going to start treatment immediately. Mm-hmm. Well, it's all about taking care of the systemic portion of the disease as the patient's job. So, taking care of your diet, getting some exercise, taking your medication, seeing your primary care provider, your endocrinologist, as you should. If you do those things, you're probably not going to have much issue. It's when you don't go see those people, or you don't take your medication, or you don't think you need it, is where you get yourself in trouble.
Absolutely. If you're just joining us, we're talking with Dr. John Large from Riemer Eye Center this morning. The topic, diabetes and your eye health and eye care. You'd mentioned about kind of what it looks like when you are in that exam room. Is there signs other than the blurry vision that that diabetics should be looking for to help them sort of almost self-diagnose themselves, to be able to say, hey, you know what, I need to get in there? And it's a two-part question too, because we should be going to get our eye exams on a regular basis anyway, right?
Correct.
Okay.
An annual dilated eye exam is pretty much standard of care for everyone, but it is definitely standard of care at a minimum for any diabetic.
Okay. All right. And again, those symptoms, you talked blurry vision. what other symptoms might happen that we, as the individual, can maybe is there pain? Is there other things that go along with that?
In the eye world, typically it's the blurry vision that's the big one. And, we're not going to know until we dilate and look at you. But, let's say you do have regular eye care and you come see me annually and you're of a certain age. Let's say you're in your 30s or 40s and you show a big distance prescription change, like you take a lot more nearsighted power to optimally correct your vision. That's a big red flag for us. Because at that age, that really shouldn't be happening or isn't very common to happen. Okay. So, and we might not even see when we look in the back of the eyes, hemes or blood in the eye or retinopathy at that time. But it's a big tip for us. If you're showing a big prescription shift, you don't have anything else to really explain it. It's like, hey, let's get you over to your primary care provider, do some blood work and see how it comes back. Oftentimes that patient comes back to see me or us a few months later to recheck the prescription, and they're like, oh yeah, they found out I'm diabetic.
Yeah.
Well, absolutely. And once the sugar gets controlled, then their prescription goes back to what it was prior.
Do you find that you're almost one of the first steps for somebody to find out that they're diabetic?
Not usually.
Okay.
That's not as common. It does happen.
Okay.
Semi-frequently, but usually they know they're diabetic before they see us.
Okay. All right. And looking at those symptoms and part of that exam, let's talk about as a diabetic, does the process of the exams, what happens in the exam room change once you are a diabetic? What is that difference from just somebody with, just wears regular glasses or contacts and doesn't have that disease?
Yes and no. At our facility, we do really thorough dilated fundus exams on everyone because you just never know what you're going to find.
Okay.
So the procedural portion is pretty similar. However, if we do see any of those signs of retinopathy, blood, fluid, exudate, any of that in the retina, then we're going to do more testing to see, is there thickening in the retina? Is there edema or swelling in your central retina? And if there is, then you get to go see my colleagues, A. Riemer or B. Riemer.
Okay, yep.
And then they take over the care from there because you're beyond what I can do at that point.
All right. And it's good to know that Dr. Andrew Riemer and Dr. Brandon Riemer, they can do some of those operations right in-house there, right?
Absolutely. It's very convenient. We're very lucky to have them in our small community.
And speaking of the operations side of it, I'm sure people are asking, is this reversible? Is with surgery? Is that going to remedy it all? What does that look like and sound like?
Yes and no. Again, the most important thing at that point, once you're at a stage where you're getting treatment from the ophthalmologist, it's really important to get your blood sugar or your A1C under control at a good level and keep it there. That's going to be the best case scenario for your prognosis. And if you do that with treatment, oftentimes with diabetic macular edema or the swelling of the retina that they're treating, that will subside and you may not need treatment at all or as much going forward. Okay.
As a type 2 diabetic myself, this has happened to me, and if you don't mind explaining this a little bit, is that I think a lot of people know that I announce games at Grand Valley State. I'm their public address announcer, and I was drinking a Gatorade. And my vision changed. You could actually see the vision change in that moment, and things became very blurry, and it was very tough to see at a far distance. Now, it changed back, but it took a while. It took days to kind of adjust back. Is that a sign of anything, or is that obviously probably high blood sugar at that point? But can that be something that is a symptom or sign that maybe things are going to progress in a negative way in the future?
Yeah, it's very likely that what you're noticing was that prescription shift that I was speaking of earlier, and we call it a myopic shift. Okay. There's a lens in the middle of all of our eyes called the crystalline lens. And what happens when this blood sugar is higher and it causes the shift in your prescription or change is that lens's index of refraction, or how fast light passes through it changes. Sure. So the density of that lens changes in uncontrolled diabetes or, high blood sugar. That usually preempts the retinopathy or the bleeding in the retina stage.
Okay. All right. So good to know there. Now it's normalized, which is good, and that's a while back. But it goes to show that with diabetes, these changes can happen, and it probably scares people. I would assume that, and it prevents them from maybe driving during a certain period of time. As you get older, you might not be able to drive because of diabetes, and I've heard a lot about that too, right?
Yes. In this state, you have to have 20/40 vision in your best eye or better to get an unrestricted driver's license. Well, it does not take much retinal swelling to get you worse than that metric.
And you'd mentioned it a few moments ago, and if you're just joining us, we're talking with Dr. John Large, Riemer Eye Center, about diabetes and your eye care. Reversible, or at least you can slow the process down with the technology that you have now. I mean, that's pretty apparent, right?
Absolutely.
Okay.
So I always call it the magic machine, but we have the best microscopes you can buy in the office, but and I have good vision. I'm very adept at looking at the retina and seeing thickening or swelling, but this machine called an OCT, we put you in front of it, it can detect small pockets of fluid that you have no chance to see with the naked eye, even through the microscope. Okay. That's really key at getting to the edema portion or disease portion quickly. Okay.
Let's as we wrap up this morning, and I appreciate you coming in and talking about this. What questions or what information should that person with diabetes come to that eye exam with? What are those questions that you're going to be asking them to help prepare them?
When was your last eye exam? When was your last appointment with your primary care or endocrinology? And what was your hemoglobin A1C number?
Okay. Yeah. Very, very important information. And working with their primary physician hand in hand, you're going to be able to provide information so that they can take that back to their primary physician too, right?
Every diabetic eye exam afterward, standard of care is to send their primary care and or their endocrinologist a letter stating to that doctor what we see in the back of the eye. It's a huge advantage in the eye world because we can see your blood vessels live without having to do surgery. So they want to know what that looks like because at the end of the day, pretty much diabetes is a disease of the small blood vessels and how they're functioning.
Okay, very good information there. What have we missed talking about that we can relay to the listeners this morning? Anything that we missed that comes to mind?
Go see your primary care doctor annually. Go see your eye doctor annually. You do those things, it's going to be pretty hard to mess yourself up. They're not going to allow that to happen. They're going to put you on medication to tame that problem. It's almost always the bad cases are, the people who don't necessarily see their doctor regularly or as they probably should. Diabetes, I believe it's 35 million people in America have diabetes. That's about 13%, and it's supposed to increase as our population continues to age. Now, 1/4 or 25% of those 35 million don't know they have diabetes.
Yeah, shocking. And that's where you come in and the team, Riemer Eye Center and the eye physicians throughout the listening area, that we should have those conversations. We should get those exams done. We need to find some of those answers. And like I said earlier, you probably, somebody doesn't know. And you said this as well, is that if you've gone years and years and years without an eye exam, then you're failing yourself. You need to make sure that you do that. Does it matter if you are young or old when it comes to this? I know diabetes tends to be an older disease, but what about the kids or young adults? Are you seeing any of that in regards to diabetes too?
Yeah, your type 1s are going to be much younger on average. Well, obviously, they grow up and get old too. But type 2 tends to be a more adult onset. but each one can do the same thing. It's just as important for the type 1s as the type 2s to keep that under control, or they'll have the same issues.
All right, good information this morning. Riemer Eye Center and Dr. John Large, he is with us, and we appreciate you coming in. We want to make sure that we encourage the listeners, and that's why we do this segment on a monthly basis. We encourage the listeners to go see the team at Riemer Eye Center. I'm actually headed over there today. I've got an issue with a sty in my eye, and just talking before we went on the air, my impression was, okay, maybe it'll go away after a while, and it really hasn't, but there's solutions to advancing that. There are solutions to advancing correcting some of those diseases that, like we talked about with diabetes, and those it just starts with a conversation, doesn't it?
Absolutely. Just get in there, tell us what's going on. You're not ever going to embarrass yourself. We've heard some crazy things, so it doesn't matter. We're just there to help you and get your eye health in better shape.
All right, sounds good, and you guys are doing it. Dr. Large, we appreciate you coming in this morning, and you're always welcome back. I know we'll see you back here in the studio in the future. And if anybody has any questions, you can always post a question on our Facebook page. The team at Riemer Eye Center will follow up there. Give them a call as well. Reach out to them. So, Dr. Large, thanks for coming in this morning.
Thanks for having me.
Absolutely. It is 7:40 now on 102.7. It is Mom FM.
The West Shore Community